Hello, and a very warm welcome to UMCC Medical Consultant Connectors. I want to start by reminding you of something incredibly important. Your health truly matters to us. We are here to provide clear information, compassionate information, reliable information to help you navigate your health journey with confidence. Today, we are going to discuss two topics that are deeply personal and often misunderstood: missed abortion and threatened abortion. These subjects can be difficult to talk about, but knowledge is a powerful tool. Our goal is to shed light on these conditions, offering you the information and support you need. We believe that by understanding these experiences, we can better care for ourselves and for each other. Pregnancy is a time filled with hope, anticipation, and a wide range of emotions. Before we dive in, please take a moment to support our channel so we can continue bringing you valuable health content. If you find this information helpful, like this video, subscribe to our channel and click the notification bell so you never miss an update. Sharing this video could also help someone else who might be looking for answers and support during a difficult time. Your engagement helps us reach more people who need it. Thank you for being a part of the UMCC community. Now let's begin our important discussion on missed abortion and threatened abortion. Let's start by gently defining what a missed abortion is. This term, which we also refer to as a silent miscarriage, describes a situation where a fetus has unfortunately stopped developing in the womb, but the body has not yet recognized this loss. As a result, the physical signs of a miscarriage do not occur: bleeding, cramping. The pregnancy tissue remains in the uterus, and a woman may continue to experience pregnancy symptoms for some time. This can make the eventual discovery of the loss even more shocking and emotionally challenging, as there were often no outward signs that anything was wrong. One of the most difficult aspects of a missed abortion is the lack of clear, early warning signs. Many women have no idea that the pregnancy is no longer viable. They might still feel pregnant, breast tenderness, morning sickness. However, some may notice a subtle fading of these pregnancy symptoms. The primary causes are most often linked to chromosomal abnormalities in the fetus, which are random events and not something a person can control. It is not caused by stress, exercise, or anything the mother did or did not do. It is a heartbreaking but natural event that can happen in any pregnancy. A diagnosis of missed abortion is usually made during a routine prenatal appointment. A healthcare provider might first notice it when they are unable to detect a fetal heartbeat with a Doppler device. To confirm the diagnosis, an ultrasound scan is performed. The ultrasound is the most definitive tool, as it will show that the embryo or fetus has stopped growing and, sadly, does not have a heartbeat. In some cases, the ultrasound may show an empty gestational sac, a condition known as a blighted ovum, which is a form of missed abortion where an embryo never developed. This news is often unexpected and deeply upsetting for expectant parents. Receiving this diagnosis is an incredibly emotional experience. Once a missed abortion is confirmed, your healthcare provider will discuss the next steps with you. There are typically three options for management: expectant management, medical management, or surgical management, often a procedure called a dilation and curettage, or D&C. The best choice depends on your medical situation, personal preference, and your doctor's recommendation. We will talk more about support later on. Now let's turn our attention to threatened abortion, or a threatened miscarriage. This term is used when a pregnant woman experiences symptoms, most commonly vaginal bleeding, during the first 20 weeks of pregnancy, but the pregnancy is still continuing. It is a warning sign that a miscarriage might occur, but it does not mean loss is inevitable. Many women go on to have healthy, full-term pregnancies. The cervix remains closed. An ultrasound will confirm the fetus is alive and has a heartbeat, a hopeful sign. The most common symptom is vaginal bleeding, ranging from light spotting to a heavier flow similar to a menstrual period. Some women may experience mild abdominal cramping or a dull lower backache. Any bleeding in pregnancy should be evaluated by a healthcare provider immediately. Do not wait. It can be frightening, but bleeding in early pregnancy is relatively common and not always a problem. Possible causes: implantation into the uterine wall, hormonal changes, minor cervical irritation. None of these necessarily endangers the pregnancy. If you have bleeding or cramping, contact your doctor or midwife right away. Your provider will want to assess the situation. They will ask about the amount of bleeding and the color of the bleeding and perform a physical exam, including a pelvic exam to check if the cervix is closed. They will likely order an ultrasound to check the baby's heartbeat and development, and may order blood tests to measure HCG to ensure levels are rising appropriately. If threatened abortion is diagnosed and the pregnancy is viable, there's no specific medical treatment to stop it. Your doctor will likely recommend you take it easy. This often includes pelvic rest, avoiding intercourse and not using tampons. Sometimes bed rest or reduced physical activity is advised, though effectiveness is debated. The primary approach is careful monitoring. Your provider will schedule follow-ups to recheck the baby's heartbeat and monitor your symptoms. This waiting period can be very stressful. Emotional support is as important as medical observation. Experiencing a missed or threatened abortion is, honestly, an emotionally taxing journey. Uncertainty, fear, grief. It is so important to acknowledge and validate these feelings. Surround yourself with support. Lean on your partner, trusted family members, close friends. Your healthcare team is a key part of your support system. Doctors and nurses are there to provide medical care, guidance, and compassion. Beyond your immediate circle and medical team, many support organizations and resources exist. National support groups, local support groups, both in person and online. Care for yourself physically and emotionally. Allow time to heal. Recovery takes time. Be gentle with yourself. In closing, I want to leave you with a message of hope. While the experiences of missed and threatened abortion are undeniably difficult, they do not have to define your future. Many women who go through these challenges go on to have healthy pregnancies and build the families they dream of. Staying informed is one of the most empowering things you can do. Continue to educate yourself, ask questions, and advocate for your health. Thank you so much for joining us today for this very important conversation. We hope this information has been helpful and has provided some clarity and comfort. If you found value in our discussion, please give this video a thumbs up. And don't forget to click that subscribe button and share it with others who might benefit. Your support allows us to continue our mission of providing accessible and compassionate health education. We are here for you, and we are committed to being a trusted resource for your health and well-being. Thank you again for your time and for your trust in UMCC Medical Consultant Connectors. We send you our very best wishes for your health and happiness. Please take good care of yourselves and each other. Remember always that your health is our top priority. We look forward to seeing you again in our next video. Until then, be well and stay strong.